Well, welcome, Rebecca Rathmell, to my podcast. How are you?
Thank you. I'm good this morning.
We are here to talk about Binghamton, New York, and so a particular place and a particular topic, housing insecurity and homelessness. But there's a bit of a backstory that I want to get through that begins with a gentleman named Guru Madhavan, who is a systems engineer, a very well-known one, and he wrote a book called Wicked Problems: How to Engineer a Better World, I believe. And Guru did his graduate work at Binghamton University, where I got to know him. And so in his book on wicked problems in general, he features Binghamton, New York, as a place where it was kind of the Silicon Valley of its day, including Edwin Link and the first flight simulator. And so this is early in the history of aviation. And the idea of simulation, that you might, in order to train pilots, not just put them up in the air, but give them some kind of experience on the ground, was a breakthrough and a way to solve a kind of a wicked problem
Hmm.
of flying an airplane. And so Guru's book very artfully blends the general issue of wicked problems and how to solve them with Binghamton as a region. And so he actually dedicated the book to Binghamton and he launched the book in Binghamton. There was an event at the Roberson Center, our local science museum, and the mayor was there, including some of our council members. And I believe the mayor dedicated that day to Wicked Problem Day or something like that. And so I'm there
Yeah.
also, and thinking, wouldn't it be great for Binghamton to be known, and its university, Binghamton University, to be known as the city that's adept at solving wicked problems, and that its future could be as dynamic as its past. And so that's where I
Love that.
I came back into the picture now as president of Pro Social World and emeritus professor at Binghamton University. And at that point, housing insecurity and homelessness emerged as a particular wicked problem that might make progress on. Why is that? In part thanks to you, and as someone who is passionate on the topic and very experienced, and some other people um, in the city council that were also passionate about this issue. And so it seemed like a good place to start, you might say, on the wicked problem of housing and homelessness. And then another reason for this is that there's a um, another nonprofit organization called Community Solutions, headed by a wonderful woman named Roseanne Haggerty, that's actually become very renowned for homelessness. And they won the MacArthur Foundation's $100 million grant,
Yeah.
100 and change grant. And I happen to know Roseanne. We go back a little ways. And so I thought, wow, this is great. We have, this local thing. We could bring in community solutions. Let's do this.
Hmm.
And it's thanks to you really as a as the the main leader. The Norwegians have a term, Inchfelt, I think it's called, which means fiery soul, the person who gets things done. And so you're the fiery soul for this. So with that very long-winded introduction, please introduce yourself
Gosh.
as a person, and how did you become so passionate about housing insecurity and homelessness?
Sure. And the fiery soul piece is very much appreciated. So, so thank you for that. It certainly has been the work of my life in this sector. I've lived in the Binghamton area for over 20 years now, originally from the DC area, but 18 of those I've worked within the local homeless services sector. Um, that was somewhat of a surprise for me. I didn't necessarily intend to get into homeless services. It wasn't planned or strategic. I was living on the south side of Binghamton again about 18 years ago. Um, I walked the city quite a bit. I came across a gentleman in front of the library downtown who mentioned that he was headed to a free community meal. It was a Saturday at noon. So I tagged along, and it was at a place on Carroll Street, used to be called the Carroll Street Ministry Center, Freedom Fellowship Church. And it was just a soup kitchen. It was a lunch for folks who needed the meal. And it was really, I would say my first exposure in Binghamton of extreme poverty, extreme hardship, and homelessness. And it was immediately unacceptable to me, absolutely immediately unacceptable. And I think any progression of my work since has simply been an effort to help to identify, as you say, wicked, or as Guru says, wicked problems, and just trying to help identify causes, link them to solutions, and move those forward. um, I think the most formative realization for me, those first couple of months working, I went back every Saturday for years after that. It was most often the same people, the same families, some of whom I still see around today. But what was most, I think, formative for me, I realized we had one guest, for example, his name was Gary, and he, week after week, I noticed he wouldn't respond to my greeting. Not that anybody has to, but I would just kind of nod, barely raise his head, not meet my gaze. Again, totally fine. There's no expectation. But it dawned on me that he had stopped expecting anyone to see him. He had been homeless before. I found all of this out after. He'd been homeless before. He wasn't homeless at the time. Um, but he went from meal to meal every single day because that was the only way that he could eat. And the realization that he had stopped expecting anyone to see him, stopped expecting anyone to remember his name or ask him how his day or week had been, was so devastating to me in that moment, for sure. And still, like, knowing that it was true for him and is still so true for many others in Binghamton, continues to devastate.
Yeah, let's
These
let's let's
past,
let's let's you fast forward to the present and just have you describe what is the extent of homelessness and housing insecurity in Binghamton and Broome County. Probably a lot of people don't know. They haven't had your encounter with an individual. So
yeah,
it's probably, not only is that a wonderful story you just told about an individual who regarded himself as invisible, but the problem is invisible, I think, to many people who have no reason to encounter it. It's abstract.
right.
So what is the extent of housing insecurity and homelessness in Binghamton, New York?
Sure. And I think you're right. It truly was that exposure. And so, in terms of what folks are experiencing in Broome County, over 2,700 households will face homelessness throughout Broome County. This year, more than 23 individuals, about 450 families will access emergency shelter. That's a 20% increase since COVID. And if we just look at families with children alone, that's over a 70% increase since COVID. Another 100 or so will sleep on our streets. So when we refer to someone who is experiencing homelessness, we mean they're either sheltered or unsheltered. They're either residing in a private or publicly operated shelter or a hotel that DSS is contracted with, or they are unsheltered and residing in a place not meant for human habitation. So all of that, though, doesn't include households who are, we call it doubled up with friends or family because they couldn't couldn't and can't afford to cover rent on their own. So, of the 831 school age children that reported homelessness during the 2022-2023 academic year, over 600 are in those doubled up situations throughout the county, more than 300 within just the Binghamton City School District alone. Those doubled up situations are often extremely temporary, overcrowded. Binghamton City School District, largely in largely due to that, has reported a student mobility rate of 40%, which means its students within the district are moving at least once, and I would say likely 3 times a year just to
Yeah,
keep
let me
up.
focus on that, Rebecca, because when I
Mhm.
was working in Binghamton, which was a little over 10 years ago, when I was doing such things as local parks and things like that, I was shocked and astonished at that mobility that the people I was trying to work with to say build a local park and so on, they were not going to be there. And for a student to move and then to move a school district. So now they've stopped going to the school where they were, and now they're new people in a new school with all of the attendants, making
Right.
friends and all of that. My God, I mean, how could anybody function
It's
in
yeah, it
that kind of
it
environment?
impacts neighborhoods, certainly, communities at kind of that concentric circle as it goes out. The individual trauma, however, for a child who, with that kind of housing instability, it profoundly impacts their cognitive development, their physical, social development, behavioral development, so much so that the strongest predictor of homelessness as an adult is the experience of homelessness as a child. So that mobility, that instability perpetuates itself, and you remove that foundation, particularly of a home and housing instability for a child, and it has unfortunately endless repercussions, not
Yeah.
just for them, but generations of community after them.
Well, that means that there can be positive repercussions. I'm familiar with studies of this sort that show that interventions that basically provide more stability um, for a young person, the benefit cost ratio in terms of social services is like, 70 to 1,
Yeah.
100 to 1.
Mhm.
Every dollar spent towards this problem will result in $100 saved in
Yeah,
terms of
that's
future
the
social services.
right. The aspect, so there's the personal aspect, but when we get into the dollars and cents of it, I mentioned that Broom's Department of Social Services contracts with local hotels. We don't have enough emergency shelter beds within public institutions. So DSS contracts at this point, we're at 10 local hotels for just under 300 beds to provide emergency shelter because of the otherwise lack of available and affordable permanent housing options in the city and throughout the county. We are going to spend, Broome County will spend $7.5 million this year just to keep folks homeless in those shelter beds. And
Yeah.
so switching that investment, I mean, there are multiple studies. Milwaukee County comes to mind. I mean, they've reduced Medicare spending by $2 million simply by providing permanent housing, developing affordable housing, and focusing on a housing first approach. I think even if we're talking about the unsheltered individuals, so in a lot of the hotels, we're talking families, I mentioned children, school age children. For unsheltered individuals, often those who are chronically homeless, the estimate of an annual cost to a community is somewhere between 35 and 40 grand. And so when we're like rather for our numbers locally between that 7.5 million and the 3 million that homelessness is currently costing us, we're at $10 million.
Yeah.
And instead we could be investing in
Yeah.
actual solutions.
Prevention, prevention, so much better. Uh, I want to spend a little bit of time distinguishing between homelessness and housing insecurity, which of course must be joined at the hip. But if you could spend a little time on that distinction between homelessness and what we call housing insecurity.
Sure. Um, and they are inextricable in certainly some aspects. Homelessness, the entire deficiency of a place to call home. So a place to consistently and stably lay their heads for a household, for an individual. The housing instability, how that comes into play is we do see, and that's where some of these doubled up situations also come in. We see folks who may not have to, they may not be experiencing direct homelessness, meaning again, that sheltered or unsheltered definition where they are in an emergency shelter. They had no other networks to access, no other housing to access. So they are residing in an emergency shelter, or they're unsheltered and actually sleeping on the street, under a bridge, in an abandoned building, in their car. For housing instability, there may be some homelessness in there. It may be episodic, but they might be able to double up with a friend or family. They may be able to, like Gary, who I mentioned earlier, extremely precariously housed, but he was able to at least keep a roof over his head, which again meant that he was going to community. He had no funds left over for food, for personal hygiene, for transportation. So he had a roof over his head and a place to sleep, but the majority of anything he earned in a month was going to that roof, and he was having to figure out ways to meet his basic needs otherwise.
So he was actually employed in a sense, but everything got gobbled up by.
He had worked for him in particular, and yes, there are, I mean, about 40% of folks experiencing homelessness are employed, which is where the affordability aspect comes in so strongly. But for Gary in particular, at that time, he was in his 60s. He received, he had worked for the county for years, but the onset of a severe mental health condition left him unable to work. So he was just making ends meet on disability from month to month. And again, it was just enough to cover rent. So, and we see the same thing. I mean, most families in Broome County, for example, who rely on public assistance for income throughout the month are spending over 90% of that entire benefit allotment on rent, if not upwards of 100%.
Right.
So trying to, again, the basic needs met otherwise, transportation, food, personal hygiene, healthcare, all of that. It it makes just the basic surviving, let alone thriving in a community,
Yeah.
extremely difficult.
Well, I want to talk a bit about community solutions solution to this, which gets us back to wicked problems in general, because wicked problems by definition are very highly systemic. You certainly can't attribute this to what an individual did. That would be far, far too simple. And so what community solutions does is uh, brings together all the stakeholders that are needed to be brought together. That's the systemic part. And then after they get that kind of coordination among the stakeholders, and these are um, uh, institutions and agencies, and there could be a big university involvement or research involvement. Um, then so now you're taking a very systemic approach, but then you train that on each and every individual. So the individual is not lost in that system. You know each individual, and then you contextualize their situation, and then you use the system to solve the issues for each and every individual known as a individual, and they call this functional zero, I believe. That's
Mhm,
their goal,
mhm.
is to reduce homelessness to functional zero. That means that for everyone who becomes homeless, then that issue is solved for them within some specified period of time. Now, first of all, because you've been working with community solutions now, have I described it accurately, or would you like to improve upon the way I described
No,
their
I think
method?
no improvement. I think the functional zero term is also their methodology. So th- ending homelessness not in the sense that there are zero individuals experiencing homelessness per se. Significant reductions, certainly, but more that when homelessness does occur, it's rare, brief, and not reoccurring. So they are focusing on the individual and developing a housing strategy, a housing plan for each, typically by subpopulation. So within the homeless services sector, we talk about subpopulations. HUD actually identifies subpopulations. We have veterans, we have chronically homeless individuals, we have families, we have youth. And so community solutions hones in most typically on a specific subpopulation that a participating community has represented as their priority and develops a real time data by name list for that subpopulation within a community. So they are actively looking, as you said, individuals, they know them by name, they know their housing needs, they know their level of service need, level of vulnerability, and they're fostering what's called case conferencing conversations. Anyone within the HUD and COC continuum of care world has been responsible since about 2017, 2018 to implement something called coordinated entry. So, coordinated entry systems, very similar to what community solutions pushes forward, by name lists, real time data, case conferencing conversations that involve every level of service, street outreach worker, case management support, rental assistance, to identify the next step for that individual and ideally end their homelessness for them, and then build a system within which that happens for every from inflow to outflow. And that community solutions, I want to say, has 105 communities participating now with their, it's called Built for Zero, the
Mhm.
effort specifically. Um, I think 14 of those communities have effectively achieved functional zero. Over 40 have seen significant reductions. And they're housing people. I think one of the things that we get caught on within the homeless services sector, because more than anything else, homelessness is a housing issue. We simply do not have the available affordable units to put individuals in. That's, I mean, by and large, the primary issue. And we can get caught in that by saying, like, the city's not developing enough units, the county's not develop. All of that is true, but this still provides a strategic approach that can impact ending someone's homelessness while also advocating for solutions on the policy end and on the prevention or development end.
So community solutions provides a kind of a blueprint for what a community can do, but it's up to the community to do it. They
It
don't
is.
provide big grants or anything like that. And so it's up to us, um, the Binghamton community, to actually implement this. And so how flush that out for me. Basically, what does it mean to implement this systemic approach? What are the major
Mhm,
organizations that need to be brought together? Already are in many respects,
mhm, mhm.
um, and um, and um, and coordinated with each other. So what does it take to actually for Binghamton to become one of these built for zero communities?
Sure. I think the primary stakeholders at the core who will be or would be navigating the real-time by name data and the case conferencing for strategic solutions, that largely would be within the realm of the continuum of care locally. So just for context from HUD identifies that jurisdictions in every state, so across the nation, jurisdictions that are responsible for strategically addressing homelessness within their jurisdiction. Locally, we have a 6 county continuum of care. NY 511 is the designation. Southern Tier Homeless Coalition is also a term they go by, but it is essentially not only all of the organizations, mostly nonprofit, but also municipal, who are receiving HUD, either emergency solutions grant funding or continuum of care grant funding for shelter, street outreach, rapid rehousing, permanent supportive housing, all of those agencies who are already actively engaged in addressing homelessness directly and funded to do so are the core stakeholders. But we also we've mentioned Broom's Department of Social Services. They are a critical part of kind of that first door, front door that individuals who are facing a housing crisis have to access in order to receive services. So that's the core group of stakeholders that I would say are the ones who would be doing the very specific person related work beyond that in terms of a community, municipal, public, and institutional involvement. I think one of the examples that we have locally of institutions engaging institutional will as well as political will that could be replicated here in Binghamton, and conversations have been had around this for some time. But Tompkins County, for example, has partnered with the city of Ithaca and Cornell University. Cornell University has acknowledged the impact that its development has had on local displacement, local affordable housing
Oh, let me
availability.
dwell on that, Rebecca. This was on my list of topic points. The fact that just up the road we have a positive example in Tompkins County, which we'll get to
Mhm.
right now. But the fact that the university can be indirectly part of the problem. Of course, the university doesn't want to do this, but just by virtue of what it does with student housing
Sure. Yep.
and developing student housing in Binghamton, which has been huge in Binghamton, that can have indirect effects,
And
cascading effects, basically, and that's why the problem is wicked, right? So say more about
right.
that.
I mean, I would attribute the a significant percentage of the increases we've seen in homelessness within the last decade plus to the Binghamton University's development of its downtown center and the local proliferation of student housing. And that's not to paint the university in a negative light. It is, as you say, and likely was very much an unintended consequence of the development. But in the last first couple of years since the development of the downtown center, we started to see these increases. Um, in the last decade, we've seen over a 500% increase in the number of unsheltered individuals who have no other option but to sleep on our streets. When BU developed their downtown center and landlords and developers became more aware of the profit potential for that expansion in terms of providing rental housing for students, we not only saw hundreds of conversions of what had previously been existing affordable housing into student housing. So those conversions, meaning we lost the existing, though limited, affordable stock that we had, and we continue to lose that. We continue to see those transitions or conversions. But then the city took a very very strong approach on prioritizing the development of student housing almost exclusively for the decade after. So not only were we losing affordable housing stock, we were in no way developing affordable housing stock, and certainly not at the same rates that we were prioritizing student housing development. And so we displaced current residents from their homes, and we stopped building, almost exclusively stopped building new affordable units that they could move into. And that is the, I mean, by and large, and it's interesting, the city of Binghamton and Ithaca, and the city of Ithaca, as well as Tompkins County and Broome County, are neck and neck every year for one of the lowest rates of available affordable housing for extremely low income households in the state of New York. The entire state of New York, Binghamton and Ithaca are second lowest. Um, lowest and second
Just by virtue of their big student population.
lowest and second lowest. Yep. And it's, and again, I mean, for Cornell to have acknowledged that its development and expansion impacted local residents, it absolutely could be mimicked here. And then that began to leverage conversations at the city and council level for dedicated revenue. So that's one of, one of the primary solutions I would point to is that this model where we're not just, there's not enough federal or state grant funding to go around to solve this issue. It's been critical, it's essential in many development projects, but there's never going to be enough. So for local municipalities, there also needs to be a commitment in terms of dedicated public revenue going to the preservation and development of affordable housing.
Well, it sounds that given these ratios of prevention ratios that are so huge, that this could be net savings, basically, that if you were actually did this right, then there would be a net financial gain really from doing this. But you really have to keep the indirect effects into account. You have to, and how much coordination is there? You listed these stakeholders, um, and and but they need to be coordinated. And I'd like to know how much coordination is there already, and what can be done to increase the coordination among the stakeholders that could be brought to bear on each and every individual as we've discussed.
Mm-hmm. I think what's exciting about, so the COC locally is in somewhat of a transition, um, in a good way. They're transitioning their homeless management information system lead, which is the database that all of the service and those experiencing homelessness, all of their information is tracked in HMIS, is what we call it. And then the COC is transitioning in their coordinated entry system lead. So the two very specific entities that pull the real-time data required to target individuals by subpopulation, and the coordinated entry system, which is the one that uses that data to develop case conferencing conversations, that is all transitioning into like under new leadership locally. It hasn't been, and this would just be my opinion, but it hasn't been effectively implemented. Coordinated entry certainly has not been effectively implemented locally to where there is that very coordinated, targeted, and strategic approach. The group that is coming on to lead coordinated entry moving forward has expertise and experience in doing that coordination. So we should see a better system, hopefully a more accessible system and a more strategic system. But it really is the COC that bears the responsibility. It's not all on the COC. It's obviously going to take the service level of other agencies and their quality performance in that regard. But so I think that's a lot of words to just say it hasn't been functioning well locally, but I'm optimistic that it will improve with this transition in leadership.
I would hope so. When I was doing this kind of work in the past, things that seemed easy proved to be really difficult. we wanted to do something where we'd track like school attendance and have like a friendly competition among neighborhoods to get kids just to come to school. And the data's there, but it was not there in a way that could be manipulated at all. They
Mhm.
have these specialized systems for data that are extremely difficult to work with. And it just went on and on. We'd like to resolve things at the block level, not the block group level. On and on and on about how the data exists um, in many cases, but can't be worked with. And that leads me to a question of what's the role that the university can play at the level of the university administration. We've already covered the fact that, gosh, we have to face up to the fact that the university is a problem and therefore should be committed to contribute to the solution. But then when we look within the university at all the different relevant departments and centers, and I mean, we have so much expertise in complex systems thinking, after all, back to the heritage of Binghamton, the Watson School. Um, um, and so what what would be what would you say about the contribution that the many, many units within a university, in addition to the commitment of the whole
Mhm.
administration, can contribute to this?
It's interesting. I think there's a lot of, as you said, groups within the university who are doing good work currently. You've got Wendy Wall and the Source Project, who are looking at um, just redlining in Binghamton, tracking discrimination within housing in Binghamton for years, and looking at deeds and Binghamton 2 Degrees comes to mind, identifying systemic connections, the intersections of housing insecurity and the climate crisis. What I think the first thing that I would want to point out is students and professors elevating to an administrative level the responsibility and opportunity to acknowledge the institution's impact. We've not seen that to the extent. I sat down with President Stenger in 2017 to talk about the increases that we've seen in homelessness since the development of the downtown center and the anticipated displacement that we would see in Johnson City as he develops or as the university develops their school of nursing. Uh, offered a displacement prevention strategy. And I think we've just lacked the acknowledgement at that executive administrative level that does commit. I think it does take a financial commitment. Again, we've got the Tompkins, Cornell, City of Ithaca model to mimic. Um, but if we were recognizing Binghamton talks about driving industry, driving community locally. But if we were recognizing that there's not a single outcome for any sector in Binghamton and Broome, the healthcare sector, um, the justice system, schools, as we've already pointed out, unless we stabilize housing, so many of the outcomes those sectors are pushing towards can't be achieved. I think
Back to wicked
students,
problems. This is my little waving my wicked problem
right,
flag that everything is connected to everything else and not in a good way.
and I think students, it's been really encouraging in the last few years to see students acknowledging and recognizing the institutional impact. We have a houseless street outreach group, originally trained, I want to say in November 2021. But it's just about entirely run by BU students now. They're going out at least once a week, most often on Wednesday nights, and they're canvassing the known locations where we know folks are staying unsheltered. They're bringing supplies, they're bringing food, at times they're bringing medical
So
supplies.
there's a student group that does this?
There is, yeah.
Yeah.
And it didn't start as just a student group, but it is now currently just about entirely run by student volunteers. And they and that engagement has been not only so encouraged, I would say to me personally, just knowing that because I've worked in street outreach, it's um I mean, in large part where I've started and where I've stayed because it's so essential. But to see them every single week, they're leading their own work on this, and they're identifying who they're seeing. They're seeing them. They're remembering their
Yeah, well, that
names.
is, I mean, that just brings us back to your origin. To actually see it in a person is the beginning. So it makes it. I want to repeat this, what we've just done for the university for some different sectors. For example, the city sector, so the city council and mayor and the city administration. What's the role that they get? I mean, that obviously has to be an essential role, but what should it be? What is it? Without pointing fingers. And then I want to do the same for the philanthropic community because, as with all cities, Binghamton has its local foundations that are want to serve the city and maybe even the business sector as to how they could get involved in this systemic approach. So back to the city council
Mhm.
and the mayor's office, and so what's the best and what's the current reality without pointing fingers?
I think at a city level, the biggest opportunity, well within their jurisdiction, would be developing the brick and mortar units that we need to be able to put unhoused individuals in, to be able to provide homes. And what I mean by that at a city level is the city is largely not doing the actual development, but they can prioritize affordable development when we're looking at within zoning and within grant funding and within approving the planning committee and city council and the mayor approving projects that are proposed at those tables that are going to offer and develop deeply affordable housing. That I would say is first and foremost. So it's also dedicated public revenue, which I've mentioned before. We have There are HUD funds that come to the city of Binghamton in the form of community development block grants, home funding, emergency solutions grant funding. That gets allocated every year. We get just about the same amount every single year. That is a federal allocation, but we do not have a dedicated revenue stream within the city that is identified solely for the preservation and development of affordable housing. We have a local housing trust fund that was seeded and is hosted by the community foundation locally. So they exist and could absolutely oversee a dedicated revenue source. But the city has not made the decision to say that we recognize our own onus in ensuring that every resident has the opportunity to find a place to call home and home for themselves and their children. Um, that dedicated public revenue is a model. I mean, hundreds of cities across the nation. 60 states have identified housing trust funds with public revenue. So it's not even really a new solution. It's just not one that we've
Yeah, I
committed
want to
to.
earmark that there's as soon as you think to look, there's positive examples everywhere.
Mhm.
So we don't have to invent something really. I mean, we have to contextualize it in its implementation, but there are so many positive examples, and there's a sense in which we kind of know what works, but implementing it is another
Right.
systemic
I
problem.
One of the things that very often pops up in terms of what can be challenging about implementation. So I've been talking about developing, producing more affordable housing. That is key, but we also need to preserve the existing affordable housing that we have. And we currently within the city of Binghamton have a code enforcement department that is reactive rather than proactive. And so most often that has meant that we're allowing housing to deteriorate to the extent where it can only be demolished. We have a significant demolition budget line item in the city budget. 450,000, I believe, for this next year is proposed. And that's because we see that deterioration. We're not making a proactive effort. This is another representation of examples that are working and functioning effectively elsewhere. Proactive code enforcement simply means that there are regular inspections of rental housing within a city. And rather than what we currently have, which is somebody has to call about a property and then code will come out and they will take a look at the conditions of that property. They will identify violations. They'll notify a landlord who has a certain number of days to remedy that violation. If they don't, they'll send them more notice. If they don't, they may fine them. If they don't, they'll go to court. It's a long drawn out process that is proven incredibly ineffective when it comes to actually being able to preserve existing stock. Instead, if we do regular inspections and also pair that with a rental registry and a licensing program so we know who owns what, and we know that they have to demonstrate the habitability of where they intend to allow humans to occupy. All of that together, proactive code enforcement, that rental registration and licensing, that effectively preserves stock. And if we're doing that on the front end with what's existing and also developing more, then we're getting somewhere.
Yeah, that's really great. Yeah, thank you. Yeah, so well, what about the philanthropic community? You've already talked about the community foundation
Mhm.
as playing a positive role here. So want to say more about what the
Sure,
philanthropic community can do? The United
sure.
Way is also part of this, so I think,
Mhm.
and there should be, obviously, this is what they do. Uh,
Yeah, and to start with the community foundation, again, just to make clear that so folks know that this even exists, the Community Foundation hosts something called the Broome County Housing Trust Fund. It was seeded through an anti-displacement initiative, excuse me, at the county level in 2021. Um, it has had, originally we were able to seed about 400,000, but that bumped up to just under $1 million in dollars that are exclusively reserved for the preservation and development of affordable housing. There's also eligibility within there for like relocation assistance, fair housing support, tenants' rights supports, some rehab dollars. They've already had 2 funding rounds and have supported several programs. But as that initial seed money diminishes with them allocating grants, we need to identify a way to sustain that funding, to identify dollars in perpetuity. That's where the dedicated public revenue comes in, but also anyone can donate to the
okay,
Housing Trust
okay. So
Fund.
basically, this is amazing. There's a system already in place for distributing this money,
Absolutely.
and basically, we need to put fuel in the engine.
Absolutely. And you mentioned United Way. There are organizations like United Way who and other foundations, Clee Foundation comes to mind, but other philanthropic entities who have done a lot to compile the data, who have maybe done their own needs assessment and can speak to the priority issues that their organization has identified. But I would also raise the Community Foundation up as another model of they identified housing insecurity. as the number one issue or a top issue. And then they adjusted kind of their funding focus around that top issue. I think that's an opportunity for so many of our foundations locally. What are the top issues? Housing is always going to pop up. And then how can, I think some of it too is those foundations reaching out to community groups rather than waiting for community groups to come to them. So some active community engagement certainly there. But if we need to be, yes, building the units, but we also need to be providing households with what they need to stay stable in their new homes. So I mean, there's no way it doesn't fit within a philanthropic focus somewhere. Um, and being able to say we recognize this as a wicked problem, if not the wicked problem, and here's how we can adjust our allocations and focus to support solutions.
Yeah. Yeah, you know, it's a little out of sequence, but I want to think more about measurement, and because this systemic problems like this cannot be solved without a really good measurement and as you said, real-time data. Not only do we have to measure things, but we have to renew our the information very, very fast and compare it to what we're doing. And there seems to be an impressive amount of this already. At the beginning of our conversation, you were rattling off numbers, you know, how many students are moving between schools and beds and so on. So talk a little bit about how the measurement of all of this already exists to a degree, maybe even an impressive degree, is being tracked, but I'm sure it can be improved. But so the whole measurement system and this whole kind of real-time data,
Mm-hmm.
this data cannot be a year old or even 6 months old. I mean, this has to be refreshed, just like the weather, I think. And to think of a wicked social problem as like the weather, a very complex physical system that's difficult to predict because of its complexity, and that we need to have the simulation and the measurement and for social weather, you might say.
Yeah.
So talk a little bit on that topic.
And it's I don't know if it was super funny for me in the beginning, but I guess it's a little funny for me now. I learned very early on in this work that the data is not easily accessible. Um, any of the data that I mention when I'm speaking anywhere, I track it annually, but it has come from like pulling multiple different sources, figuring out where the data is warehoused over the years and just keeping track of it because it's not, some of it is not public. Some of it is simply not publicly accessible, or some of it is not readily accessible. And in some ways, it's just there's no central, I mean, aside from a template that I keep that I share out any and everywhere because I'm not at all proprietary over it because it's difficult to find the data. Um, I think in terms of measurement, and maybe before touching on that, one of the things that I also thought early on as I started to gather the data and then connect the dots when it came to the sources of the increases that we were seeing, um, there was something in me that believed that if I just educated elected officials enough, if I just educated institutional leadership enough by sharing the data, shouting the data, screaming the data. I mean, I've shared public comment at more city council meetings than I can count in the last decade plus, submitted more proposals. Like the data is absolutely essential in representing the problem, but it's the community and the political and the institutional will that will actually move any significant impact or change forward. That's it is. I spent years really just only talking about the data, thinking that it would be so huge and so unexpected that that alone would change people's minds, and very much learned that it doesn't. I think in terms of um, measuring it, I would give kudos to Broome County. Within the last year, they did a housing needs assessment, and the group that they partnered with, contracted with to do this assessment, came up with, I mean, it's over 300 pages, so it's lengthy and not everyone's read it, but it's significantly helpful in identifying not only the scope. I mean, a lot of the data that I mentioned in the beginning is well represented in their housing needs assessment. Um, but also, even they've got an entire chapter on housing opportunity sites, 80
Okay.
locations throughout the county where housing could be developed. Some of them are publicly owned, some of them are privately owned. Um, but I think like we don't need, honestly, anything else but a commitment to start moving some of these solutions forward. We have all of the data that we need. Are there opportunities like we've talked about with Built for Zero to get more strategic, to hone in? Of course. Um, I'm a data nerd, so like the more data, the better, sure. But like we don't actually need any
Okay.
more.
Data not the limiting factor. That's kind of nice to know. Necessary,
Mhm.
but not sufficient. Acting on the data is needed.
It's
A-
acting on the data for sure.
And also, it seems to me, it's so telling that all of this began with you meeting a gentleman on the street. And that student group is no doubt fueled by knowing them as people, as
Mhm.
individuals. And I want to bring in like that would be something like when I ask the question, what would anyone do? Just anyone listening to this, no matter whether they might not be the head of any unit or anything like that, but they could get to know somebody or
Mhm.
someone. And so the faith community, of course, it does this. Of course, it does this a lot. So I'd like to say a little bit about the faith community and maybe finish up with the concept of block clubs because you and I have been newly talking about, wouldn't it be great? And this is another case where there's models to emulate from other cities, including the city of Buffalo, it turns out. Um, Something as simple as forming a block club to address all of the issues of the block, not just homelessness, but that would be, and so there would be another case in which by
Mhm.
improving just face-to-face relationships,
We
people knowing each other as human beings on your block
we
would,
can't we and I'm sorry, I'm just tracking with you. We can't solve homelessness in this community unless we're able to see those experiencing it as human and those experiencing it as our neighbors. They're unhoused neighbors, but they're still our neighbors and members of our communities. And that goes for each of us in our homes or apartments in the city of Binghamton, but all the way up to city council and executive leadership and department heads. They are residents and citizens, just like we are. They have interests and hopes, just like we do. And so until we can see them as human and the concept of community, there's so much within the constructs of our systems and structures that can disconnect us and that can other or dehumanize entire populations of individuals based on a preference or an opinion. But that exposure, for me, that started what has become my life's work, that exposure for the street outreach group that has become their focus, when you can't deny that someone experiencing that hardship is no different than you, when you get to know them, and rather than seeing them as a homeless person, you're seeing them as Dennis with a dog whose wife died and he lost his job. Like, there's that human component to it, and that expands to community. If I value and see my neighbors, not for their, I don't know, annoying dog, although for me personally, I don't know that I've ever met an annoying dog, but just as an example, like if I can see them as my neighbor, as a fellow human, if we can get to know each other rather than our political preferences or what divides us, that's that to me is where my focus, I would say, in the last couple of years has been more on community. What can community look like? I mean, it was uh, Grace Lee Boggs who has said we need to reimagine everything, all of it. We need to reimagine how we do community, how we do labor, how we do education, all of it. And it takes each of us individually, internally, and then externally. I mean, we've got to build something new because what we are doing is not working. This is not it.
Well, that's beautiful, Rebecca. I can improve upon that. So I think that's a great way to end, except one thing, only one thing to improve upon that perfect ending of yours. Um, and it's to stress the concept of multiple forms of capital, because often we think that this boils down to money,
Hmm.
um, or information, but in fact, there's just so many ways to contribute to something. So that means that whatever the current source of information or financial capital is, other things that could be done. And there's social capital, there's intellectual capital, there's spiritual capital, um, and so that means that really anybody has something to contribute at some scale in some way, if they um, uh, appreciate the problem and to see the humanity in the people that are involved is the first is the first step, as you said. And you also pointed out inner and outer. And I think there's a whole piece to be said there about how this involves inner work, how we think and feel about life, and then how we act upon that, and the need for that action to be not just individual action, but individuals joining up with other individuals. It must be social action. And so I think, and whatever we decide about that for homelessness, we can transfer it to any other wicked problem. So, as wicked as it is, homelessness and housing insecurity is just one of many wicked problems, and they're all interconnected. That's what makes them wicked. But isn't it nice to know that as we develop the capacity to solve one wicked problem, then we're simultaneously developing our capacity for other wicked problems. And so this is something which everybody should be paying attention to, no matter where you live. But also, it can be applied to any location, such as Binghamton
Truly.
or Tompkins County or Buffalo or any place else on the face of this earth. And so that's what we're attempting to do. And so thank you for your role and your own passion.
Thank you. I appreciate that the conversation, David.
Okay, thank you.